What is your age?
65 years.
What is your occupation? What do you do?
Driver.
Are you married?
Yes.
Mm. So for how long have you feeling the complaints? Do you have chest pain?
Yes.
Do you have allergy? Any
Mm,
kind of allergy?
No.
Do you have and do you have been to any kind of disease of lungs like TB or lung cancer or any surgery?
No. No.
Okay. Is there your any family history of hemophilia?
No.
Okay. Um, so do you drink?
Yes.
Okay, you drink. So do you have diabetes?
No.
Do you have stroke?
No.
Do you have just myocardial infection or heart attack
No.
anytime?
No.
Okay. So
After the subjective examination, we observe that the patient has severe chest pain, dyspnea. The patient has no bruising, gum bleeding, or edema. The patient also has no history of gastric ulcer, allergy, blood transfusion, hemophilia, diabetes, and operations.
do you have runny nose?
Yes.
Do you have watery eyes?
Yes.
Do you have cough? Yes, I can see you have
Yes.
cough.
Yes.
Okay. So do you have sputum in your cough?
Yes.
Okay. So the color of sputum is green.
Yes.
Okay. Uh, so do you have chest pain? Do you have
Ye-
difficulty in breathing and speaking?
Yes.
Okay. Let me check your pulse and your breathing rate. Take deep breaths. Okay. I have to check your pulse. Okay.
After the respiratory examination, we observe that the patient has respiration rate of 30. Partial pressure of oxygen is expected to be low as the patient has dyspnea, less short breathing. Partial pressure of carbon dioxide is expected to be high as the amount of carbon dioxide expelled is high. Lactate level is expected to be high as the level of oxygen to oxidize the lactate is low, and the pulmonary artery wedge pressure is normal form of respiratory failure is primary. This might be resulting from pneumonia as the bilateral low lobes which may cause by bacterial infection. Bacteria will destroy the alveoli which causing trouble in transporting or receiving oxygen and expelling carbon dioxide from and to the body. Damage of alveoli will produce hyperemia, swelling, exudation condition. That is why the patient is having cough. Inside alveoli have edema or secretion for sputum which is blocking the oxygen in and carbon dioxide out. This is why the patient will have cyanotic blue and dyspnea.
I'm suggesting you to do X-ray of your chest and blood test. That is a complete blood count, CBC, and sputum test.
The hydrostatic pressure of the lung is normal. Thus, sputum examination is done to detect bacteria. To confirm, we will perform laboratory tests and instrumental tests. Perform a bronchoscopy to look into the lungs airway and obtain a biopsy or a mucus sample. The operating doctor inserts a small tube with a tiny camera attached to the mouth into the lungs. A person receives medication before a bronchoscopy to numb and relax the throat, and the doctor typically also gives intravenous sedation medications. After the X ray examination, we can observe the difference between the normal lungs and the lungs which is infected with bacterial pneumonia. After the final diagnosis, we perform antibiotics treatment administration. After taking swab tests from sputum, patient has Streptococcus pneumonia infection, we use first generation cephalosporins. First generation cephalosporins have active coverage against most gram positive cocci, such as Staphylococci, Streptococci, while having minimal coverage against gram negative bacteria. Observing the activity of hemostatic system, activity of the hemostatic system is high and thromboembolic complication is present and hemorrhagic complications are absent. By administering heparin as anticoagulant, an activation of the coagulant cascade leading to severe hypercoagulability has been detected in this patient. Therefore, early anticoagulant may reduce coagulopathy, microthrombus formation, and the risk of organ damages. Heparin used for the prevention and treatment of the venous thrombosis and peripheral embolism.